morning, Malaysia. Welcome to the Lim Ren En Life Success Stories series. This show is dedicated to improve the lives of people who want a positive change. I have the privilege to know many successful people throughout my career, and I have witnessed many amazing stories of successful business people who came from humble beginnings and made it in life. There is a formula of our success, and you too can be a successful person. My name is Lim Ren En. I'm a father of 4 beautiful children, an amateur bass guitarist, and a husband to a beautiful doctor. I am a senior insurance manager with AIA Berhad, a 11 times MDRT member, and also a 3 times Court of the Table member, currently serving as the country chair of MDRT Malaysia. I dedicated my life to helping medical doctors and SME business owners providing insurance protection for their families and businesses. A simple quote from the legendary Josh Devon: "When you see me, don't think of insurance. But when you think of insurance, see me." Welcome to the Lim Ren En Live, and today we have a special guest, Dr. Adrian Yong.
Thank you. Thanks, sir.
Yes, it is a privilege to have Dr. Yong here, Dr. Adrian Yong. Dr. Adrian Yong is a dermatologist and also a dermatologist surgeon. There's not many dermatologist surgeons in Malaysia. In another word, he is a skin specialist. Adrian did his medical studies and training in UK, and however, he has decided to take a decision to come home and serve his country and his family. And today, Dr. Adrian is a resident doctor for AY Skin Specialist Clinic and specializes in skin disease and aesthetic medicine. So today, Dr. Yong will discuss in length with us his success in life and the secret of aesthetic medicine, bringing out the beauty in you. So let's welcome Dr. Adrian Yong. Thank you so much, sir, for coming to the show.
Thank you.
You know, it is a privilege. I knew you from a very different circumstances, right? I got to know you when one of my cousins had a skin problem, and he came and see you. And I was figuring out how to write the medical report, and I came and saw you, right?
Yes.
And that was done. You helped us a lot in getting the medical report done. Thank you so much. That's how we met.
Yes.
And we got to know each other better, and things just roll on from there. And it's such a privilege to have you here. So, Adrian, tell us a bit of your background and where are you from?
Okay. I'm originally from Seremban, but I was born in University Malaya in PJ because my dad was then a medical officer working in the hospital before he then decided to move back to Seremban to start his own private practice at the time. Yeah.
So, you were saying your father is a doctor in UM, then moved to private practice in Seremban. So, your father is a medical doctor. Now, in your early childhood, I'm sure that you have seen your father work with patients and work the clinics. How did your father inspire you?
Yes. So the first thing actually, the first way I knew my dad was a little bit ironic. It was not that, I was sitting next to him, like how I am sitting next to you, and that the patient was in front of him, and I saw how good a doctor he was. How I found out how good a doctor he was at school. "Oh, you're Dr. Yong's son." "Oh, on the street, it's like, I've got a problem now, I need to go and see Dr. Yong." So I felt that, he made such a big difference in Seremban, that his name was well known on the streets, and, he was making a big difference. But as his son, I rarely saw him. I always heard his name much more than I saw him. Yeah. But that really inspired me, that he dedicated his whole life to treating his patients, even late at night, 9, 10 p.m. after he's closed his clinic doors. Sometimes you get a call from a patient who says that their mom is very ill and they're living in a small district in Rembau, and they'll say, "Can you come over for a house call?" And he will go straight there. The supper in his car, he was about to bring it home to feed us, but he said, "Just wait for another half an hour." He drove to Rembau. Yeah, so he did it out of love and out of passion, out of care, concern for his patients. And that really inspired me as a young boy.
I'm sure that you are so proud of father, right? Yes. You try to emulate
emulate his life and become as best a doctor you can. And he has helped so many people in the town of Seremban. Where is his clinic actually?
Oh, actually it's in Jalan Tuanku, Munawai. And it's been for the last 15, 20 years. Yong Specialist Clinic. Yeah. So it's been there for many, many years. Yeah.
So your father is also a specialist?
Yes. He was a gastro specialist, but in those days, there was no specific, sort of specialization courses in Malaysia. So it was more of an apprentice where you would learn the ropes and then, you start doing the procedures slowly. But time has changed, and now there are very structured programs to specifically specialize in certain medical specialties. And you have to enter the courses to be able to be trained and fully get a stamp at the end.
Mm-hmm. Yeah. So why didn't you go actually and become a gastro, but then you decided to do skin?
Yes. So everyone's journey is different, and my journey was different. A lot of the influence that I had was when I was, because I spent time overseas in the UK, right? I grew up as a boy in Seremban, but I then went to Singapore. I was living in a boarding school all by myself for 4 years under the ASEAN scholarship. And then from there, I applied to the UK to do medicine. And when I got in, I wanted to chart my own path. I wanted to have an identity and not be just like my dad. Secretly inside, I would have always felt that I want to be version 2 of my dad, which is a better and more successful doctor than he is. So, not that a dermatologist is more successful than a gastroenterologist, but I would say that, my main interest when I got into university was that in, making sure that people had the confidence to be able to do what they want in life. And a few experiences when I was there, including a fellow classmate who almost dropped out of medicine because they had very, very severe acne with scarring, and they were getting depressed, and a simple tablet and a visit to the dermatologist managed to change their life around. And they then succeeded and became one of the distinction students. And that was my first thing, that there are a lot of people who just say, look, skincare is just superficial, it's not important. But there are a lot of people out there who are suffering incredibly, both physically and mentally. And even until today, I'm very proud to say that there are patients who come to me and they come in crying and they leave smiling and laughing. And I think that really makes it worth the while.
Now, you're saying that, that is quite an amazing story, right? You came from the small town of Seremban and you went to Singapore under the ASEAN scholarship, which is the smartest of Malaysian actually only can apply right now. And from there, you're boarding school, and then you went to UK. If you look at yourself from your young age, right to boarding school and right to doing medicine in UK, what is that thing that makes you so successful in what you do in every stage of life?
Yes, I think the key ingredient here is focus. And I think I'm a very focused individual. So much so that when I have something in my mind, I normally just I'm like a horse with 2 blinders on, and I will keep going until I get it. So I think that's the key thing about it. If I've set my mind to doing something, I do not give up.
Mm-hmm. Yes. So meaning from young, you knew that you want to be a doctor, just like your father.
Yes.
But when you're in UK, you decided that you want to do skin.
Yes, correct.
Yeah.
I actually explored a lot of the different options. Mm-hmm. I even explored cardiology, I explored plastic surgery, I explored radiology. But in the end, the people who inspired me the most and the experiences that I had were all skin related. And and that's how I got into it.
So how many years were you in UK?
Okay, so from the time I went, I was 17. And by the time I left, I was 35.
Full scholarship?
Well, the first part, of course, in Singapore was full scholarship. In the second part in university, my dad helped me a lot.
All right.
Okay, and it's a debt that I'm trying to pay back, but I don't think, at his stage, money is a concern. It's more to do with the image. I think it's more to do with what has become of me, what I can contribute to society, and what I can match. So what he contributed to Seremban, I'm hoping that I can contribute to the whole Klang Valley. And
Fantastic.
This is an improvement of what he is.
That is wonderful, It is about serving, not taking, giving and not just taking, right? I think that attitude makes you who you are today. And your clinic, Dr. Adrian Yong's clinic is at Damansara, Uptown Damansara.
That's right, yeah.
Just right opposite Starling Mall. Right, it is quite visible. Later we'll show you where the clinic is and you'll be able to find him. Now tell us, you spent actually close to 18 years in UK and you had a family then.
Correct.
You were married.
Yes.
Your wife is also a super achiever. Right? His wife is a super achiever. Your wife is a international banker.
Yes.
She was working with some real good banks. Yes. But you guys decided to come back to Malaysia.
Yeah.
Why?
Okay, two main things. Her dad is alone now. Unfortunately, her mum passed away when she was young. And a lot of her siblings have already emigrated. And we felt that, for our parents to have sacrificed so much and to have paved the way for us to achieve our dreams, I think the least we could do is to come back and be able to be around in times of need. And I think that was one of the main things that we were considering, the main factor. The second thing, of course, is you can't take the Malaysian out of me. Even after many years, my diet, my habits were all very Malaysian. Still want to drive everywhere. I still want to eat Malaysian food. I was the only one who would be microwaving sandwiches in the hospital queue. And 2 steps behind me was my other Pakistani consultant, who was also microwaving sandwiches. Because we can't take cold sandwiches in our stomach. You see, so we need hot food, good food everywhere. So I think that's the second thing. And of course, the third thing is when I managed to specialize in dermatology there, when the blindness was off the sides of my eyes, and I looked around and I thought, okay, I've reached a stop here. Where should I go next? And I looked at my options and I thought the ratios of the number of skin specialists in Malaysia, population is about 30 over million. Mm-hmm. There's about 100 specialists only.
There is only 100 skin guys
in the whole Malaysia, who is national specialist registered.
Okay, those are like dermatologists plus dermatologist surgeon.
Dermatologists only.
Oh, okay.
So whereas in the UK, you're talking about a population, of course, larger, but their consultant numbers are about 500 or 600. So in any single hospital, you have about 7 or 8 consultants, even in every single city you're talking about. All the football cities you can name, there'll be at least 7 or 8 consultants there. In Malaysia, most states will have only 1 consultant. Sometimes 1 consultant serves 3 or 4 states.
We are not underserved by doctors, but we are underserved by certain specialty.
Correct.
Certain specialty.
Yes.
It's just like the vascular guys. There's only 26 of them in the whole nation. But the vascular guys does all the diabetic food, all the pots and all that, chemo pots and all that. So that is the thing. So as a derm surgeon, your job is not just to see skin problem, right?
Correct. Yes.
So tell us, what does a dermatologist surgeon does?
Okay. Now, my main bulk of work when I was in the UK was skin cancer surgery. So, but of course, skin cancer is not as prevalent in Malaysia as it was in the UK. I'm talking about something like 10 to 15 cases of excisions or removals per day of skin cancers. And even at that rate, as a trainee, as a consultant, we were not able to clear the backlog because there were that many skin cancers. Okay. Now, my main task when I come back is basically acne cysts, boils, and then pus areas because of our weather. It's very hot, it's very humid. A lot of those conditions, boils occurring on the face, on the armpits, and so on. So that's the main bulk of work. The second bulk of work is that of scars, keloids, which are overgrowing on the chest, on the arms, on the back of ears. Yeah, and that is where it's a very, very nice position to be in, where we can play with lasers because I love technology, and combine, scalpel, the appropriate use of that, and lasers to give patient the best. And you know, when I first came back to Malaysia, I had big dreams in setting up all these things in University Malaya. Okay, but there are limitations to what we can have as a, you know, in terms of funding, in terms of setup, and in terms of job scope. And I think that was the main thing that I felt that, you know, as I've mentioned before, that once I have the blinders on, I'm very focused at what I want. I want to be able to practice dermatology at its best. And the only way I could find that is not even in a hospital. It's only in my own practice, where I can define exactly what the parameters are.
That's why when I visit your clinic, it doesn't feel like a Malaysian typical clinic that you find anywhere. Your clinic feels like you're in London. You know, it's different. There's a slope going up to the clinic, you know. The doors, of course, is bigger. That's the clinic standard.
Yes.
But the aesthetic and everything is very different. It's different, you know. I think you set it up purposely that way, right?
Yes. I think the priority that I always had is accessibility. And I want to be able to cater not to just people who are concerned about their looks, but also people who may be in nursing homes, people who may not, you know, from the early days I mentioned that my dad used to do house calls, right? That I want them to be able to access it via wheelchair. So we have parking right in front of the clinic. I actually chose that spot so that we can have our own private space, so that if they booked an appointment, they can actually come in through that access door.
Yeah.
Yeah.
So you choose to have a clinic in Uptown Damansarang, but at a bungalow, I think.
Yes.
It is a bungalow, so that's why he has a private parking. It is quite easy to actually go to his clinic. Basically, I always park in front of the clinic. There's always spaces. Sometimes there's no spaces. There's too many patients. But anyway, most of the time they are, right? And it's just a walk away from Starling Mall. So it's very, very easy to access. And I love that slope, you know, that wheelchair slope to your clinic. And that actually brings a lot of thinking into actually setting that up. Nice job, you know, very nicely done. Now, the next thing I'd like to check with you. So, aesthetic medicine. All the ladies out there, this is what you're waiting for. Aesthetic medicine, making you beautiful, right? Now, about aesthetic, what good does aesthetic medicine bring to people? Tell us about aesthetic medicine in general first. What is that?
Okay. Aesthetic medicine is defined as, you know, the art and the science combination in improving a person's appearance. That's basically a definition. And that definition can be quite fluid. Why? Because if you feel that you've got enough hair, and I was going to tell you, you know, I can make you grow more hair, you will not be happy with me. So the definition of an improvement in appearance has to be the marriage between what the patient wants and what the doctor wants. I think that's the most important aspect. When that starts to diverge, you start getting horror outcomes, yeah, where things don't look so good, don't look natural, and in fact, maybe over the top, to the point that there are people who will be kind enough not to say anything, but they clearly feel that it's distasteful. And I think we have to be very careful, because when aesthetic medicine is overdone, you can have adverse outcomes. It actually makes it look worse than before.
So let's see some of the things that you do. Let's switch to the slides and presentation that we have prepared earlier. So this is some of the things that Dr. Yong, Dr. Adrian, can I just call you Dr. Adrian now?
Yeah,
that's fine.
Yeah, that's fine.
That is easier. This is some of the things that you do, and I can see eczema on children. Is that eczema on children?
Yes, very common. Very common.
My second child actually suffer from this very much.
Yes.
So you do see eczema,
yes,
in adults and children as well, right?
Yeah.
So
yeah, I'm proud to say out of all the eczema patients that I get, I tend to get the very complicated ones, which is good. Why? Because they have been to probably 4 or 5 other doctors, and they've not found a solution. And it's very satisfying when I can get to the bottom of things and give them a cure.
that is great. For that, I must compliment you. A lot of people actually look for the easy way out. I've seen one of the dentists that I saw. I went in for a filling. I said, could you actually, he he did a temporary filling the first time, then second time it came off, I went back. And he gave me another temporary filling. So I told him, doctor, could you give me a permanent one so that it lasts longer? You know what he said? He said the temporary one lasts you for 8 months. What's wrong with that? I'm like, oh my God. You know, a lot of people looks the easy way out.
Yes.
But I like your attitude. Your attitude is that you like to do the hard thing and get it done.
Yes. Yeah.
My third child is actually grown out of eczema. That's the lucky thing. She still has some problem. Maybe later you want to see her. All right. So tell us about this, Adrian.
Yes.
This is, what do you call this condition?
This is vitiligo. 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 And it is an autoimmune condition, which means your immune system decides to attack your own pigment cells. So the pigment cells reside on the top layer of our skin, okay? And the purpose is to give us sun protection. So for pigmented skin, for example, Chinese, Malay, and Indian, African skin, in the order of getting more and more melanin or pigment, it becomes more obvious as a problem if you're dark skin. Okay? So vitiligo still exists in Caucasian people too, but they are never as psychologically affected as the darker skinned people. And in fact, such a condition in India is thought to be a condition where a potential son-in-law would be rejected. Why? Because this condition actually mimics or looks like very much like leprosy. So leprosy can be white, it can be a rough patch, maybe they are losing nerve processes and limbs and so on. So, I think this is a condition which is very emotionally loaded, okay, in the sense that it really affects someone's self-confidence. And I know of my lady patients who have this, and they would spend at least 10-15 minutes every day just to make sure that the makeup will cover it up completely before they leave the house.
Now, is there a cure for this or not?
Unfortunately, not at this stage. But I would say that there are a lot of treatments available to control it. So creams are always the first line, and then phototherapy, which we offer in our clinic. And then thirdly, pigment cell transfer, which is surgery, to transfer the pigment cells from one area to another. A bit like hair transplant, but using the transfer of pigment stem cells into the site.
So can our patients go and see you on this?
Yes, they can.
Do you do this surgery and do this transplant and all the lasers that you're saying just now?
Yes, we do. Yeah.
So how was it? Will it actually 100% cure or make better like 90% or 80%?
Now, with time, given 3 to 6 months, I would say that majority can improve by about 70 to 80%. Okay?
That's not bad.
Yeah. However, certain areas, for example, around the mouth and on the back of the hands, those are the most challenging parts where we have to keep hammering with a very, very high dose. When we say hammering, it refers to using very high dose medications and also using phototherapy at high doses to try and achieve what we need to achieve. Yeah.
But yet again, it is much improved,
Yes.
Okay. So if you have, to the audience outside, if you do know somebody who have this problem, Dr. Adrian is somebody that you can go and have a look and see him. Now, this is skin cancer and psoriasis.
Correct. Yes. So skin cancer on the top is also known as pigmented basal cell carcinoma. Now, this is very common. So basically, the risk factors are excessive sun exposure, genetic background risk factors. So it can occur anywhere, and the scary part, it may look like an age spot. And very commonly, this is underdiagnosed in Malaysia because very few of us would think of it. But having seen about 10 to 20 a day during my training in the UK, I would recount the experience in when a patient came in and kept telling me about his legs, and all I could do was stare at his nose. And he said, "What's wrong with me, doc?" And I said, "You have something that's a lot more important than what you're trying to tell me, and I think we should remove it today." And
Which is a skin cancer.
True enough, 2 weeks later, the biopsy came back, and of course we treated his legs as well. But it was one of those stories that I always remember. Yeah.
Right. So psoriasis is something it happens on the scalp, but sometimes it happens on the other part of the body as well,
Yes.
right?
Now, the thing about psoriasis is it's not just it's not just a skin disorder. People will see it as a disorder that is psychologically and socially unacceptable. They can't go swimming, they're embarrassed. Every time when they sit down on a sofa like this, when they leave a lot of dead skin behind. Okay? Those can be embarrassing factors. However, what is important is the fact that psoriasis is associated with other conditions. For example, joint problems, known as psoriatic arthropathy. So the arthritis is very similar to things like rheumatoid arthritis, where you get joint stiffness, pain in the heels, maybe in your knees, your hands, and you can't really move properly for about half an hour. Then that gets better. Then nail disorders, where the nail will start to lift up, become very brittle, and you would want to hide them because they're very unsightly. And then, of course, the hidden diseases. So metabolic syndrome, like diabetes, hypertension, high cholesterol. Those have all been linked to psoriasis. So for all my patients who have psoriasis, I always tell them to try and reverse all those risk factors, and their psoriasis tends to get better as well.
I have a friend, this young guy, who is in his, mid-20s, and he has this problem of psoriasis on his foot. And I've seen quite a lot of dermatologists, and he has been doing injection. And he said it helps, but once it's off the injection, it comes back again. What do you say about that?
Yeah, so it depends on what kind of injections you're referring to. But of course, if it's the biologic injections, which are can be on the pricey side, it actually tackles the whole root cause of the problem. But of course, we can't get to the absolute root, which is gene therapy. Because the problem is with the genes, and that is expressing itself in a way that causes the skin to turn over very quickly and to promote inflammation. So things like, for example, alcohol consumption, stresses, and taking the wrong medications can cause a flare, right? Now, so the injections, the fact that we can get to a point where injections can control it completely, meaning that you might see him on a day-to-day basis and you think he's been completely normal, I think it's a good enough progress for the moment, okay? But they're, of course, very expensive, very pricey to maintain. Yeah, you're talking about 30 to 35,000 a year. Okay, it's like paying for a private school fee for the rest of your life, because basically this condition can last 10 to 15 years. All right, but the better way is to look at it more holistically. If you can make lifestyle changes, dietary changes, that will be, of course, good. And of course, if you use topicals, phototherapy, and other tablets and treatments that are more cost-effective, that can make you go further. Because the average cost of all the other things are around 5 to 10,000 a year, rather than 30 to 40,000 a year. Yeah.
So some other things that you do, let's go to aesthetic, right?
Yes.
So let's go to the interesting part, aesthetic medicine. Now, this is, what is this? Tell us, what is this?
Okay, so the picture of the lady before is the same lady as the one that's below. But the difference is, number one, if you look at the forehead lines on the top, okay, which we can reproduce here, and also when you smile and you have this crow's feet at the side. Now, all these are due to muscle overactivity. And a very common problem that people have when they are getting old is that they start to have, long-sightedness, and they have to keep doing this. And the line in between can get very deep, and the 11 lines become extremely deep and unsightly. There's also habitual movement, where every time when you talk to them and they just do this and this and this, and then they have those exercise book lines on the top. Yeah. So these things can be solved by injecting very small doses of Botox. And when I say small doses, I mean small doses, because the Botox was something that originated from the US. And the doses, just like the portions of the food, are a little bit larger than what Asians consume. And I think that's where the translation of practice is a problem. When you start using the American or the British system in terms of the dosing, you run into problems. And I certainly had that experience when I first came back from UK with that.
So now, Botox, is it safe?
Yes, it is a very safe medication, FDA approved, provided it's original Botox. So the horror stories that you've heard is unlicensed products, pirate copy products, products that are injected by non-medical staff that may be diluting it or mixing with other contaminated products.
And I heard people telling me on the internet, they say after you put in Botox, if you put in too much, then you have what we call the plastic face syndrome.
Yes.
So does it really cause that, Botox?
Absolutely, which is why I say if you follow the charts of the originator, the people who actually started using Botox initially, and you just follow it by the books, you will get a plastic face. But if you start using it in adjusted doses according to how much muscle activity, and you tailor make it to your muscle activity, then you'll be very natural looking.
Aha.
So you have to be very careful. Yeah.
So ladies, you heard him. It takes skills to do Botox. So you better do it with the right guy, right? Better do it with a legal practitioner, a person who really knows how to do this. All right. So now we know the answer. So let's go back to this. This, wow, my mother will love you. My mother have this, and she's trying to get rid of this. So these are what they call it, sun freckles,
Sunspots or solar lentigo. Okay, and these are accumulated over the years, and it may show her commitment as a good mother for bringing her kids to school, driving them, or even walking under the hot sun, and that's why there's so much sun. Or maybe she was working a stall, you know, so on. So these things are accumulated sun damage to our DNA, which has caused this protective mechanism to appear. But it does make you look more, unclean, and perhaps less desirable, okay? And less confident perhaps, because when this lady came to me, she was putting a lot of foundation, makeup over it. When she first came, she said, I have a big pigment problem, and I couldn't see it at all, because it was covered with thick makeup. But that's the final result without makeup, and she was very, very happy after that. So I think, there are technologies, not everything should be lasered, okay, beware, because there are certain conditions like melasma, which is actually a hormonal condition, which is a little bit like vitiligo, where it's not curable. And one has to be careful that laser isn't an answer to everything. A lot of patients come in and say, okay, I want this laser, I want that laser. Then when I tell them what can be lasered and what can't be, bring them down, then you can understand what can be achieved and what can be achieved safely, rather than something that you imagine from other perhaps advertisements that you've seen. Yeah.
So at the end point is actually going to see a person who actually really knows how to do this, not just a deep derm, diploma in derm. There's a lot of GPs who take deep derms and say they are derms, right? But actually to see a real dermatologist, right? So this lady, so this looks like a facelift.
Yes.
Is it a facelift?
Well, it's a non or minimally invasive facelift, in the sense that in the olden days, plastic surgeons, derm surgeons would actually excise the areas around here on the sides of the ear, and then stitch up the whole tissue to pull up. So
excise means cut.
To cut. Yeah. But nowadays we can use less invasive methods. So you can see the 4 little plasters there. That was to mark out the areas where we've put a thread in there. So the threads that are used to stitch after you've had surgery, after, let's say, you have a C-section, that kind of stitches. But this is modified to last longer, about 9 months, a year. And not only that, the stitches have actually been adapted and made to have little barbed areas on the side to be able to lock down the tissue and suspend it. So this can be done on an outpatient basis. You don't have to be put to sleep. Okay, it's just injected with local anesthetic, and you can achieve this. You walk out in half an hour.
So you are saying I can get a facelift without cutting through my face from my forehead to my ear, but actually put a thread across to get the same effect.
Yes.
And safer.
Yes, certainly so.
Wow. So the plastic guys must still, do they do the same thing?
Yes, the plastic surgeons actually do threads. There are also other technologies like high-intensity focused ultrasound, which is a machine-based device to try to achieve the same thing. But of course, for the more severe cases, if you want to subtract 15, 20 years, then facelift is still the way to go. The durability, depends on how long you want it to last. But most people nowadays, they're healthy, they're fit, and they don't want to undergo surgery. They don't want to have a long downtime of hiding away from people for 3 weeks to a month. Even with the MCO and even with the mask regulation, they're still very wary of having that kind of downtime. Yeah.
Now, tell us, Adrian, how young can a patient come and see you with this?
For facelift, like
Yeah.
this? Okay. So for a thread facelift, I would say that the ideal candidate is someone who have lost some weight, okay, and perhaps has some sagging fat, which is descending, earliest possible mid-40s, okay? Now, if you're younger than 40, then I would suggest doing high-intensity focused ultrasound, which is a machine-based device first, to maintain it. Because having a thread put in at that age might put you off beyond that. Because once you put a thread in, of course it's a procedure, there is a material that is in there that with time will start to stimulate the collagen and tighten up. But there is a material there that will change your face structure. And you would only want to do that at a later stage when your bone starts to recede, rather than when you're still young and you have a lot of volume to make up for it.
So the thing is that do not do it too young. Do it at around mid-40s
Yes.
or early 50s.
Yes.
Yeah. So ladies, you heard it. Can men do it?
Yes.
Do men come to you and do it?
Yes, they have. And mainly, actually, it's more popular for men because guys are more like, the way they shop are very similar to women as well, where they want a quick thing. They walk in, they get it, they walk out. So actually, more men than women prefer this approach to lifting. Yeah.
Right.
Because it's a quick fix. Yeah.
So do you think I need it?
Well, I think you're perfectly fine at the moment. You're looking very healthy.
You're just too nice. So let's talk about this. So what's this? This is like a...
Okay. So the first thing to look at is the lower eye bags in the before picture, in the top picture. And then below you can see the eye bags disappearing somewhat. And what I've done there is inject fillers just under the groove here on the bone, which does two things. Firstly, when you put more volume here, it lifts up the skin and create this lifting effect. So the cheeks don't look so heavy anymore. Secondly, you can also open the eyes up and the eyebrow by injecting a little bit here. Okay. So it's basically like scalp facing, the face sculpting, sorry. Yeah, face sculpting, where basically we are injecting the fillers in to achieve the shape that you want. So the same thing can be done for the chin, same thing can be done for the nose, and so on. Yeah. The other common indication is having sunken temples. As one gets older, it gets very sunken in and look old. We can actually inject fillers in here as well to fill it up on the sides.
Now, you're injecting what kind of material? Silicone, Synthol, or? No.
Silicone is no longer used, and it's a very dangerous product to use.
It's illegal to do that, right?
Yes. So we use hyaluronic acid now. So hyaluronic acid is actually part of our skin. We produce hyaluronic acid, okay, and it's broken down by an enzyme called hyaluronidase, which is present under our skin as well. So the difference with the hyaluronic acid, which is injected in, it's processed such that it's cross-linked so that it will last longer. So about a year and a half for it to last there. And the way it works is it draws fluid in so that it allows the tissue to look plumper and have more fluid.
So it's not meant to last forever?
No.
So basically, after 1.5 or 2 years, they have to come back and redo it again?
Yes.
Something like a repeat procedure to make you continuously look young.
Yes. However, the reason for that is very good. Why? Because, for example, if you were to inject a fixed material like silicone in there, okay, like for example, you are 48 now, and you think, okay, I'm deficient here, I'm going to inject silicone there. Now it will look good. 5 years later, maybe not so good. 10 years later, it will look awful. Why? Because the bone recedes with time. The eye socket deepens, the bone recedes, the skin gets loose. So what happens is you're left with lumps that stick out, which are permanent there. Whereas your skin has been hanging down like drapes or curtains, which are already not supporting the structure, and the bone is already gone, far gone. So you have like a tennis ball or whatever under the skin. So having permanent things injected is never a good idea, because our aging process is a dynamic process, and so should beautification be. It should be dynamic as well.
So basically, generations of Hollywood actors has went through the knife and went through all these to give the younger generation of dermatologists some insight not to do.
Yes, I mean, we learn and we get better with every generation. So it's easy to look back and say, oh, how come that was done? Just like how we're using smartphones now. And in those olden days, it would be those big Mobira phones, right? That you carry and plug into the back of your car.
You can kill a dog with that. Okay.
Yeah, that's right.
So let's continue. Okay, this is acne.
Yes.
And I think this is very satisfying, right? You've helped a young girl, a beautiful young girl, to regain 100% beauty. She's a beautiful girl. Tell us about this case.
Okay, she's actually working in a big pharma company, and she came to me very depressed. And she said she's actually from another country, but I can't mention for anonymity purposes.
No problem.
And she said, you know, I've been to 3 or 4 doctors, okay, aesthetic doctors as well, and I've had a few injections, a few lasers, but things only got worse. Then she's been for lots of different facials, and still things couldn't improve. And I spent about half an hour, 45 minutes explaining to her what the root cause of the problem is. What causes acne? Dietary causes, genetic causes, okay, lifestyle factors. And what is the root cause of the problem is the sebaceous gland producing too much oil, and you're in a hot, humid country. So what can you do to stop that? How to modify your diet and so on. And within 2 or 3 months of medications, doing a specific form of treatment called hydrofacial, where we suck out all the black and white heads externally. And then we do the laser to correct the pigment and the blood vessels. This is what we managed to achieve after 4 months. Okay? And
This is amazing, right?
Yeah. So, and the story to this after that was that she told her aunt, who was based in London, and said, can you recommend someone in London? So I gave her some names. And then the message back to me was, your friend is very expensive. So I said, why? Oh, for consultation is £290 for 15 minutes. And with £290 in Malaysia, you can get 1 whole session done, medicine, facial, and the laser with me. And so she asked the aunt to fly home, £500 flight, and she stayed for 2 months to fix her face. And then she went back to the UK.
Oh.
Yeah. So that was a very, very satisfying, you know, sort of thing to be involved with.
So you could do actually tourism medicine.
Yes. I've had patients who have come from Bali, from Indonesia, Caucasians, who have had skin cancers, and they will come to the clinic and they say, you know, there's a list of budget hotels opposite my clinic. I'm not sure. Yeah, you know.
Yeah,
So
I know.
there was a patient who came on a Monday. I did the surgery, and then reviewed him on Thursday, Friday, and then when I gave him the green light, he flew back to Bali. So he was staying opposite my clinic for 5 days. Every time I just peek out the window and I'm open, he will just walk down and come and see me. So yeah.
So basically, you do your surgery in your clinic, right?
Correct. Yes.
Inside your clinic. So you have a full surgery room ready there, and
Yes.
and there's not many dermatologists actually does that. It's very, very few. You are about the first guy that I know who actually does dermatologist surgery. And okay, you know, this is getting very interesting, Adrian. Now, this young guy, same thing, acne, but this is a bit more serious, right? He has bad scarring,
Yes.
but you managed to actually basically smooth out the scar. What do you do?
Yes, okay. Very interesting story with this one, because from the time when we started using lasers, I've always thought that we have to use surgical methods. And the conventional teaching that I was taught as a dermatologist in the UK was to use punch excision, where we use a piece of metal to grind a hole and then lift it up and then stitch it, because those are holes, right? Okay. So lasers back then, we had carbon dioxide laser, burn the whole layer off, and then let it grow back. It's like polishing a marble floor. But when I came back to Asia, I realized you can't do that, because if you do that to a Chinese skin, they will come back looking like someone has robbed them and they have been dragged on the road. It's all brown and all pigmented after that, because of the sun exposure and also the post-inflammatory hyperpigmentation. So I'm fortunate enough to have been able to explore on a few relatives, okay? And I was, this takes a lot of trial and error. So I went through a number of laser machines, and we went through a couple of different settings. And it took me about 9 months to hone this. And we managed to find a setting whereby we can do the laser. You can go off on the beach, in the sun, do whatever you want. There's no restrictions. And they come back looking like that. So I'm very proud to say that, you know, we can do something as drastic as that without surgery and without the risk of pigmentation.
I mean, seriously, you know, to all my clients and all my audience out there, if you want to get your skin done, please go and see him, right? You know, if you have insurance policy with him, my insurance will pay, you know. But make sure you can see him. Right? So now, tell us about this. This is double eyelid. Yes. I thought this is done by plastic surgeons, but you are doing this as well.
Yeah. So for skin cancer work, we do remove lesions, growths on the upper eyelid,
yes,
on the nose, on the side of the temple, and so on. So this is a fairly simple one. I don't do lower blepharoplasties, because the lower ones I normally refer to my oculoplastic colleagues. But for the upper lid, this young lady basically said that one side was not looking quite the same as the other. And from the top, there's a lot of hooding, too much extra skin. Okay? And she wanted something more permanent. So this was fairly simple. It's just taking a bit of extra skin off and then stitching it together. And the recovery is pretty quick for a young patient like her. Okay? But bear in mind, it's not suitable for everyone, and surgery is not always the answer. There are a lot of devices out there, a lot of other procedures like thread, filler or Botox, or even high-intensity focused ultrasound, that you can achieve a more satisfactory results without having to undergo the knife. So even though as a dermatological surgeon, we have the option, but we can always go, easy by using all the other treatments that are less scary.
So let me just put it in contrary. After listening to you for half an hour, anything to do with the face, if it's not involve huge surgery, you can actually do it.
Yes.
So anything that involves a huge surgery, take example, rhinoplasty, you know, to lift up your nose or thickening your lips, all these are done by plastic surgeons.
Plastics and some ENT surgeons as well.
And ENT surgeons, yes, I heard ENT surgeons. Yes. So, but anything superficial on the skin, you can solve that.
Yes, that's right.
You got it. So he's the guy to see. You know, I now know who to see on skins. I'm going to recommend a lot of clients to you. A lot of my clients are all these rich, middle-aged ladies who love to come and see you. So now, tell us who should avoid aesthetic medicines. Who should actually avoid it totally?
Okay. Now, people who should avoid aesthetic medicine will not have insight, meaning that they would often go from one doctor to another. And by the time they come to you, or me rather, they would say, actually, I've already seen 2 or 3 other aesthetic doctors or plastic surgeons, and they keep telling me I shouldn't do it. That's always the alarm bell. And to me, that is an issue with self-image. And I think with that, we would actually need more psychological help and psychiatric evaluation. Okay? Now, I'm not talking about people who are seeing things, hearing things, or think that other people want to kill them. It's basically the people who, when they wake up and they feel that, for example, their right eyebrow is much higher than their left eyebrow, and they're very fixated on that. The moment you say it's not true, they get really angry with you. And I think those people should stay away from aesthetic medicine, because it's a very dangerous field in the sense that you would be correcting, or rather in the surgeon's eye or the doctor's eye, it would actually be worsening of their looks. But to them, it is improvement of their looks, which comes back to the point of the definition of aesthetic medicine.
Yeah.
So when the two doesn't marry and doesn't agree, then one should not pursue it.
So there is in America, there's this guy called the human version of Kent. You know the Barbie doll Kent?
Yes.
Have you seen that guy?
I haven't.
That guy had that guy have done like maybe 60 plastic surgeries on him. What is wrong with this person? You know, tell us. I mean, as a doctor's point of view, we're not passing judgment. We're just purely engaging in a conversation on this. What is wrong with people who go through like 80, 90 plastic surgery to look so artificially pumped up, you know? What is your view on that?
Yeah. Now, I think aesthetic medicine is interesting because it's a little bit like art, where it's very subjective. Okay? Subjective in the way that if you had the definition of yourself looking like you were 20 years old, even though you're 80, okay? Some people may perceive that as being all right. But for other people, they would think, look, you're my classmate and you look like that when you were 20, but now when you're 80, you should look a little bit closer to maybe 60 or 70 at least. And I think that is defined by human norms, by society, right? So it's a very difficult question to answer in the sense that it places a judgment on the value of what is important and close to you, okay? But what I can comment on is the fact that if you had a significant problem with your skin and that stops you from doing the job that you want to do, for example, if you're an air stewardess or someone in the service sector, and you have a really bad, big pus pimple on the cheek, and no one wants to see you, right? So that clearly is a real medical issue that translates into benefits of aesthetic medicine, improving your quality of life. But on the other hand, if you are in a position where you are trying to improve yourself beyond what normal society would expect, then I think that's when people start to raise eyebrows. Yeah. So, but I think each person for their own. I think these are personal values.
True.
It's difficult to comment.
I think it's personal value. I think it is his choice to make. And I do have a doctor who is a plastic surgeon, one of the best in town. He told me, Renan, you cannot believe one thing. Throughout my 25 years being a plastic surgeon, the prettiest girl will come to me and tell me they want a boob job. And the doctor will say, he said, Renan, they have the perfect boob, the perfect body, and they still want a boob job. Sometimes he has to spend hours to talk them down.
Yes.
It is personal thing. You might see a beauty in it, but she doesn't. She wants it better. And that is personal preference, I would say. So tell us, where can we find you?
Okay, so you can type into Waze, AY Skin Specialist Clinic, and it will bring you straight there. That's it. It's as simple as that.
So his clinic is right opposite Starling Mall. It's at Damansara Uptown. It is very easy to find. It is just on the main road. It's very easy to park. There's no reason to say cannot go get parking, cannot find you. And I would like to say thank you so much. Thank you, Adrian, for coming to the show. And I think whatever you have shared with us gave us value in understanding aesthetic medicine and who should do it, who should not, what are the safer way to do it. And for Asians, I think you have carved out basically a new kind of treatment, like to take care of Asian skin and in our weather. And then that is applaudable. So anybody who has a skin problem, please go and see Dr. Adrian Yong. If you have a problem with the insurance policy, come and see me. I'll sort it out for you, right? So any last word for the audience before we go?
Thank you very much, Renan, for inviting me. And this is a very unique platform to share this with. So thank you once again. Yeah.
Thank you.
Yeah.
So next week, we will see Cheryl Tan in our show. Cheryl Tan is the Bo Cameronian Best Actor winner this year. And she is also a familiar face on Singapore media and amazing jazz singer. Thank you so much, Adrian, for coming up. And I'll see you again. All right, let's catch up for coffee again, right?
Thank you.
Thank you.